fundamentally, amid COVID, it has raked up the global economy, society, and community. But it's also time to talk about the solutions. Some of the best practices which we have learned in the past, which we can apply, and we are still learning. Ashwajit Singh is a founder and managing director of IPE Global. IPE Global is a leading entity of the world that sort of provides technical assistance to World Leading Development Agency, includes World Bank and other agencies across the world. Ashwajit has also worked around the world in some of the complex projects. He has handled starting from Ethiopia, UNICEF, Pulse Polio program, and other key important complex projects across the world. So you have seen, Ashwajit, in the past also you have worked in Africa very closely. The Ebola virus, how it's come up and how it's being handled. Based on your experience, how different the scenario is now, COVID, could you give an outlook, what you think of situation now?
I think the current situation is far worse, and is something that none of us have actually experienced in our lifetimes before, because some of the other epidemics that you mentioned, SARS and others like that, Ebola, they've actually been limited to certain parts of the world. They had a slightly different magnitude. They were serious, yes, but the impact of that was not felt globally. The closest that we have to what is happening currently is the Spanish flu that happened exactly 102 years ago. It started in 1918 and wiped out 5% of the world's population. Unfortunately, the Spanish flu lasted nearly 2 years. It lasted between 18 to 24 months before they really saw the end of it. Now we are really, what I would say, at the maybe somewhere in the middle, hopefully, of this pandemic. This is something that's had a global impact. It started, of course, with China, but there again, we really don't know to what level of magnitude it had actually reached the other countries before they started taking it seriously. Because one of the bigger problems or challenges with COVID is that the number of cases detected and the number is far less than the actual number of people who've had it. It is one of the most communicable diseases that you've got. It's spreading like nothing before we've seen. And what is really more disturbing is that they are many times more asymptomatic cases who are carriers of this, who are really still going around without being identified as COVID cases. What also I'm worried about is that there is no clarity whether the actual quarantine or the so-called safety time for them should really be 14 days. Studies have shown 14 days initially, but then certain countries have raised it to 21, certain countries have raised it to 28, and now there are reports which say that as long as 6 weeks is something that might be required. Number two, we still don't have global clarity on whether a person who's gone through this once can have coronavirus a second time. People do say that that antibodies are developed, but we're not too sure of that. So what is really worrying me is that while we are already panicking and we are panicking, we don't know whether we are seeing the end of it or any solution as of now. So it is something which a pandemic that has never been seen before by any of us who are living in today's time and age.
So Ashwajit, as we mentioned in the introduction that you have a very close association working with leading agency that also include WHO, which is a part of United Nations, basically. You see the debate and is all around the world, the way WHO handled. WHO is a primary leading agency of the world, and it's everybody pointing out to WHO the way they handle the outbreak, the information they hid the public, the delayed the information to the public. How do you look at such fundamental concern? Had WHO taken some different measures, it would have been a different thing now. Could you clarify based on your understanding?
See, Manish, I think this is a time where we need to appreciate the positive work done by all the agencies. See, there is no agency or government in the world which is not making an effort to try and control this. We can continue debating which government or which agency could have done ABC step first and maybe not delayed it up to a particular point. But the thing is that what I've already said, that we were actually fighting against an absolutely unknown commodity. You see, unless you know what you're up against, you cannot really take the best actions that may be required at that particular time. Nobody knew the scale or the magnitude of COVID. In fact, most people around the world, including, let me tell you, including the most the best known people in the medical field, also thought that this is not going to be even as severe as Ebola or SARS. It eventually turned out to be far bigger than that. So I would not really say that WHO faulted as such. I would only say that some of the decisions or the planning or the awareness took time to come. That is also because people initially thought that this is something that will be localized to China and may not spread to other parts of the world, like Ebola was localized to parts of Africa to start with. So people thought it would be contained, but now it has reached a level of huge magnitude, and it's become a global pandemic now.
Yeah, so but I agree with you. It's no time to. It's time to find a solution, and it's a complex and invisible enemy that everybody's talking about. But still, having said that, WHO sets the tone and gives direction, finds out way guidelines for around the world, basically. And having said that, India is also taking chairmanship in this month. The WHO World Health Assembly is a part of the board member that advises to Director General. What are the expectations? You see from India taking a chairmanship, some of the guidelines, how things will turn around, and also in the perspective that say one of the leading funding country, USA, is withdrawing a support system to WHO. How do you look at such complexity within while the outbreak is on?
Yes, it is unfortunate that funds have reduced to WHO, but as long as the same funds are being reinvested, whether it is directly into other agencies, but my fear is that I hope funds wherever they are being curtailed or reduced are really coming back into research of medicine, because that is important. Overall, we need to have more investment into medical research. In fact, people have been commenting that there is so much money that's gone in the past into the entertainment industry, into sports industry, etc. But now, where are all the entertainers and sports persons when we really need them to save our lives? So it is actually the public health workers who really need to be encouraged, and perhaps we need to see a lot of more research going into the sector. Now, you rightly mentioned we are fighting an invisible and an unknown enemy. So all efforts that need to be done, I think there needs to be some kind of a central collaboration where we look at what were the best practices and what were the kind of the traces and experience that other countries have had, because some of the things that still need the answers are, the death rate in different countries is varying. The number of cases in different countries are varying. What is really the different streams of this coronavirus? Again, is not just one particular virus. There are different streams. Some of them leading to death, whereas some of them are so light that you really don't even get to feel that you've got this virus. New symptoms are coming up as well. It was till about a month and a half. Losing your taste and smell was not one of the symptoms, but for the last 6 to 8 weeks now, that's become probably one of the most common symptoms that asymptomatic people seem to be having. As far as India is concerned, I think India's been one of the pioneers, and I have to appreciate that we were very, very quick when it came to announcing lockdowns and trying to contain the virus, because this virus actually needs to be tackled at 2 levels. One is the medical preparedness, where I would say that India to start with was not as well prepared, but through the lockdown we've actually got prepared, and now we have more quarantine centers, we have more kits, we have more hospitals, we have more preparedness, more awareness. Medical preparedness is one of them, and the other is the economic preparedness. Now, that is something which is going to start hitting India and the rest of the world much more as we move along, because both eventually will need to go hand in hand. But again, if I have to choose between the two, my first would be to survive, to save lives, and then to try and revive the economy. As far as India is concerned, let me also caution you here that we are far from out of coronavirus. You'd be surprised, and I try to track these numbers on a regular basis. You'd be surprised, in spite of all our efforts, India has already reached the fourth highest number of daily cases in the world. Yesterday, if you look at the figures reported, India is today higher than UK, higher than Spain, higher than Italy in terms of the daily cases. We are just behind USA, Brazil, and Russia. So cases, as we see, are only going to be increasing in India. And I would not, I hope I'm proved wrong, but I would not be surprised if the cases by the end of May, overall cases are anything between 2 to 2.5 lakh cases in India. So
is it, Ashwajit, I'll just interrupt. Is it because we did not have a testing kit, we did not have the health infrastructure as such way, and that we see the real scenario is coming up? Do you think the lack of such things is now coming heavy on us?
See, testing is, yes, one of the challenges, but again, to be frank, while we didn't have testing kits, we did also not have, see, one of the, how do you get a feeling of how many cases are there in a particular country? Because every country has X number of cases tested, and many times 8 to 9 times of the cases who are positive are actually untested and are asymptomatic. But eventually, it also leads to certain cases being on the ventilator or being in the ICU, and unfortunately, some cases dying as a result of COVID. So India's death rate, to me, the death rate and number of people on ventilators is a better indicator for the number of cases around than the actual ones being tested. So India is not fared as badly as some of the other countries, because luckily our death rate or the number of deaths reported have been much less when you look at it as far as the overall universe is concerned of the cases reported. But our biggest disadvantage is the huge population, the demographic of the population, because now when you have a case in Dharavi, it's very difficult to contain that case. And also, we do have limitation as far as medical facilities are concerned, and whether it's the average number of rooms available in hospitals, or the doctors per 1,000 patients that we have in India. We are low on infrastructure and support there. And of course the lack of awareness, because the Indian, we do have this problem of illiteracy and lack of awareness.
But Ashwajit, that brings the larger picture. As you say, we are low on infrastructure, especially the health infrastructure. We spend just about 1.5% of the GDP. We are emerging nation, and then it is far less compared to the average 6% which have developing nation have across the world. That brings the larger focus. We had such a massive gap, in building our health infrastructure. Situation like COVID brings up such things at critical level now. What is your take on that?
See, health has been a priority for government after government in India, but I don't think anybody really envisaged this kind of a pandemic being something that we would have to face. You see, let's face it, we are a developing economy. We do have limitations on budgets. We do have limitations on where we can use those budgets. We do have issues around nearly 60% of our population living below the poverty line. So the government needs to use a lot of funds for social welfare schemes, for issues around livelihood. As a result, health does sort of end up having to give some of its share to these other schemes that are required. What probably needs to be encouraged in India in times ahead, and I'm not talking about currently only, is to try and get some private sector investment, encourage that into health. We did a couple of decades ago, we did open up insurance, and we did see that insurance did have a huge impact, because even though the per capita spending in health in India is amongst the lowest, but if you really look at the out-of-pocket expenses spending, it's amongst the highest as a percentage of the spending. So people are willing to spend on health. But we need to get in more facilities, more private sector, and more health insurance coverage over the coming years.